Hey guys, welcome back to LabMedicine Insights. In today's video, we will dive into the subject of clinical chemistry and breaking it down into simple and engaging insights just for you. So, today's topic is specimen collection. So, let's get started. First of all, introduction to the specimen collection. So, there are 4 steps involved in this process. The first one is proper collection, then is processing, then there is storage of the specimen, and then the transport. These 4 steps are very critical for quality test results. Now, the second step is patient identification. The phlebotomist must confirm identity of the patient. He can confirm by asking the patient his name, number, date of birth, address, and etc. It is an active process, that is, patient should say all the details and the phlebotomist must verify all these details. In case of pediatric population, there should be parent or guardian with the child that can confirm all the details. The third step involved is types of specimen. So there are many types of specimen, as you can see on the screen. There can be whole blood, serum, plasma, urine, feces, saliva, body fluids like spinal, pleural, and ascitic, or there can be cells or tissue as in the form of specimen. Now the guidelines of the specimen collection are given by WHO or CLSI. What is CLSI? Clinical and Laboratory Standards Institute. All the labs should follow the guidelines given by the CLSI. Now let's talk about blood collection. So the preferred specimen for blood is venous blood, which is the specimen of choice. And the method of blood collection is known as venipuncture. In case of arterial blood, when it is taken from blood gas analysis, that is ABG. And the process of blood collection is known as phlebotomy. This term is very important. Phleb means vein and tomy means cut. That is, to cut the veins and collect the blood sample. It is known as phlebotomy. Now the steps involved here are, first of all, to ask the patient that there is latex allergy or not. There should be proper preventive equipment in the form of gloves, gowns, and face masks. Patient is on fasting, yes or no, and the patient should be seated or supine. Seated is preferred, but the patient, if it is not suitable for the patient, then we can take the sample in the supine position also. In the case of child, these 3 images are shown to how to collect the sample from the child. Now let's move on to the another aspect. The arm of the patient should be in the extended form. And what are the points that we have to remember here? If the arm has IV line inserted, then that arm should be avoided to take the sample. If in a woman mastectomy is done, the same side of the mastectomy should be avoided to take sample. And if there is double mastectomy done, the side on which first procedure was done, that side is preferred. Now the needle size. It is very important in the pre-analytical steps. The most common used needle size is 19 to 22 gauge. Now you all know that if the gauge is increased, the smaller the bore. More the gauge and smaller the bore. Now in the case of adults, 20 gauge needle is preferred, and in peds, 23 gauge more than 25 gauge is preferred. Now in case of less than 2 years child, dorsal hand veins are preferred over the arm veins. Now the next is location. Median cubital vein is preferred, as you can see in the image, to take the sample in the antecubital fossa of the arm. In cases of inpatient, the cannula can be preferred to take the sample, but there are increased chances of contamination and hemolysis. The preparation of the site is cleaned by 70% isopropanol, which is used, and it is allowed to dry before taking the sample. The timing of the blood draw can be vary in cases of corticosteroids or iron, which changes in the diurnal variation, and in cases of drug therapy. So that's all for today. In the next video, we will talk about order of draw and vacutainers. Up till then, thank you for watching the video, and please like, share, and subscribe for upcoming engaging content. Thank you.